Share on Pinterest. There is often confusion when it comes to palliative care and hospice. You might have even heard these terms used interchangeably. But palliative care and hospice aren't the same. While they have a lot in common, there are some important differences. Keep reading to learn more about the similarities and differences between palliative and hospice care, and how to decide which is right for you or your loved one. What do palliative care and hospice care have in common? Palliative and hospice care are medical specialties aimed at supporting people of all ages with serious, long-term illnesses, including, but not limited to, those listed below: cancer, chronic obstructive pulmonary disease, COPD, dementia, heart failure, Huntington's disease, kidney disease, liver disease, organ failure, Parkinson's disease, stroke. Regardless of the illness, the ultimate goal of both palliative and hospice care is to improve quality of life, increase overall comfort, provide emotional support for you and your family, help you make important decisions about your medical treatment. Neither types of care require you to give up your primary doctor. Both palliative and hospice care will work with your primary doctor to coordinate and manage your care. How do palliative care and hospice differ? The main difference between palliative and hospice care is when they're available. Palliative care is available from the moment of diagnosis. In other words, it doesn't depend on the stage of your illness or whether you're still receiving curative or life-prolonging treatments. The table below explains some key differences between palliative and hospice care. Palliative care hospice. Who's eligible? Anyone with a serious, long-term illness, regardless of the stage. Anyone with a terminal illness whose doctor determines they have less than 6 months to live. What does it involve? Symptom relief, help making important medical and treatment decisions, emotional, spiritual, and financial support for the patient and their family, assistance in coordinating care. Symptom relief, help making important end-of-life decisions, emotional, spiritual, and financial support for the patient and their family, assistance in coordinating care. Can you still get curative treatments? Yes, if you wish. No, you must stop curative treatments in order to qualify for hospice. Can you still get life-prolonging treatments? Yes, if you wish. No, you must stop life-prolonging treatments in order to qualify for hospice. Who's involved? A doctor or nurses specializing in palliative care, as well as other healthcare professionals such as your primary doctor, pharmacists, social workers, and counselors. A doctor or nurses specializing in hospice care, as well as other healthcare professionals such as your primary doctor, pharmacists, social workers, and counselors. Where is it available? Depending on where you live, home care is sometimes available but is most often offered through a hospital or outpatient clinic, a hospital, a nursing home, an assisted living facility, a hospice facility, your own home. How long can you get it for? Depends on your insurance coverage and what treatments you need, as long as you meet the care provider's life expectancy requirements. When can you get it? As soon as you receive a diagnosis. When an illness is terminal or life-limiting, hospice is only available toward the end of life. It can be an option when a cure is no longer possible or you decide to forego further life-prolonging treatment. In order to qualify for hospice care, a doctor must estimate that you have less than 6 months to live. Are both services covered by insurance or Medicare? It depends on your coverage, illness, and which treatments you require. Palliative care treatments are sometimes covered by Medicare or private insurance, if you have it. All treatments are billed separately, like any other visit to a healthcare professional. Check with your provider to find out which treatments are covered. Hospice is covered by Medicare, provided your doctor has evaluated you have 6 months left to live. If you have private insurance, it might also cover end-of-life care. Speak to your provider to find out what's covered and whether you qualify. How to decide on the right type of care. Deciding between palliative and hospice care isn't easy. The sooner you discuss your options, the better. Research has shown that both palliative and hospice care may be more effective when started early. Researchers have also found that many people wait too long to access hospice care. The following questions may help you decide which option is right for you or your family member. Where are you at? Palliative care is an option as soon as you receive a diagnosis of a serious, life-altering condition. Hospice care, on the other hand, isn't available until a doctor evaluates a timeline for the end of life. A person may receive palliative care for many years before entering hospice care. In some cases, someone may even recover from their condition while undergoing palliative care. It depends on a lot of factors, including illness and prognosis. What does your doctor say? Ask your doctor for a prognosis for your condition. While even the most experienced doctor can't be definitive, they can usually provide an estimate. To help you make a decision, your doctor might also be able to outline some ways you could benefit from either type of care. Are you prepared to stop curative or life-prolonging treatments? You can receive palliative care while still undergoing treatments to cure your illness or prolong your life. To enter hospice, you must stop all medical treatments aimed at curing your illness or prolonging your life. This may be one of the most difficult decisions you have to make in your treatment. It may take substantial time and reflection. You may want to talk with your family, doctor, or a counselor or social worker to help you make the decision that's best for you. If you don't feel ready to stop treatment, palliative care might be the best option for you. Where do you want to receive care? Depending on where you live, this may be a factor in your decision. Palliative care is more often available at a facility such as a hospital or clinic. Hospice care is more likely to be available in your own home. The bottom line: if you have a diagnosis of a life-altering, long-term illness, you can access palliative care. Hospice care is only available for people with terminal illnesses, or less than 6 months to live. Talk to your doctor or healthcare provider to help you decide which type of care is best suited for you or a loved one.